So Wits has been working in Soweto for a long time. We've been here since the 90s at the Baragwanath doing research with people from the community around a whole bunch of different conditions. And in the last 5 to 10 years, we've realized that it's a real critical challenge to work with young people to stop them having diabetes, to stop them getting high blood pressure in the first place. So we worked with a group of young people to talk about health and what health was to them and why it was important. And they were interested, but the biggest concern was education and employment. So we realized if we want to connect with youth and we want to change the health of youth for their futures and for the future generations, we have to think about including education and we have to think about including employment. So we started the Wits Health Hubb. Sure, so we take youth that are not in education, employment or training, and we recruit them onto a program where they do an NQF level 3 qualification as health promotion officers. Alongside that, they go out into the community. We train them how to do things like simple things like check somebody's blood pressure or check their blood sugars. And they can go door to door in the community as part of their training program and provide basic health services to community members. Part of their training as well is working in clinics and supporting the clinics. So all through the COVID pandemic, our guys were in the clinics supporting clinic staff. In the last year, our team have seen about 30,000 people from Soweto. So we recruit every year. The recruitment adverts go out in about June or July, and we look at the people that apply for the program. We'll interview for the program, and every year we'll take about between 20 and 30 young people from Soweto who are not in education, employment or training onto the program. We look for people that don't already have tertiary qualifications. So young people that have degrees, the unemployment rate for them is much, much less than for young people that only have matric. So that's who we're looking for, is the group that don't yet have degrees, to help them think about how they can get a career in health and how they can support the community in Soweto.
Phila Sonke Wellness Initiative was invited by Wits Health Consortium to attend their wellness screening at Jabulani today. Phila Sonke was involved in helping with stroke education and also encouraging people to get themselves tested and doing healthcare screenings to be able to prevent stroke conditions from occurring. Phila Sonke would like to collaborate further with Wits Health Hubb to be able to do more of these initiatives and to educate the Soweto community about stroke and where to come when they need resources for family members that have had strokes. A lot of the questions that came through were about family members who've had strokes not knowing where to go, what resources are available to them. Phila Sonke Wellness Initiative does provide these resources, and we look forward to collaborating more with the community. The vision for today was to have the community come forward, for them to have themselves screened to be able to prevent any things that would lead to further complications from their health perspective. We really wish that more people had come through just because it was a free resource, and we would have liked to see a lot more people come through in terms of checking their health and taking an interest in their health. The earlier that you start taking care of your health, the less likely you're going to have to deal with more complicated issues as time goes on. So we'd really like to encourage people to continue to look after their health so that they don't have to take drastic measures to try and cure themselves where they could have prevented it.
So my name is Delsile Gupega. I am a research study assistant at Wits Health Hubb, and operationally I'm a fundraising operational officer. So today has basically been about raising awareness. So we are screening today, we are screening for chronic illnesses like your hypertension, your glucose test for diabetes. We have people who are here for HIV/AIDS, we have Cancer Vive for cancer awareness, and we have Phila Sonke for physiotherapy. We have quite a number of stakeholders raising the awareness of your chronic illnesses in the community. Okay, so we have a program here. It provides with a certificate. It's a program for health promotion officer. We have a service provider, which is Gunokanya Training Academy. They train for the NQF education. They train the advocates. So it's a full-time program, a year program for 12 months. So you apply, you go through the process, and then you get into the program. So the program usually starts on the 1st of October. So the applications open around July, August. Yes, for the application process, because it includes your assessments and the number of assessments before you get into the actual program. So we have a website, Wits Health Hubb website, where we usually share details there about what we are about and what we do. So if they want to know the people in here, what we do as Wits Health Hubb, they can go into the website. And for information, maybe for communication information, we have social media pages. We're on Instagram, we're on Facebook. They can find us there for information, because we communicate constantly there about anything you would like to find out. And I can say the response is pretty. What I love most about my job, so the story is, actually I am the first cohort of advocates. So I was the first cohort that started in 2020 until 2021. So what I find most interesting is the switch. So the switch from being the health advocate to being the operational, being in the operational office. I found that quite interesting, in assisting the new ones and sort of guiding them through, the program expectations, because we were the first cohort, so we didn't have that form of guidance. So what I enjoy most is interacting. So because my role is interactive, so I interact with stakeholders, partnerships. So it's been lovely. The switch has been amazing. Yeah, finding out the other side of Wits Health Hubb. What we would like to address most is the tabooness of some chronic illnesses. So we sort of want to have a conversation around this and have it be a normal conversation, and have people have the correct directions, the correct people to contact, and for people to be at ease to speak about these things, and without feeling some type of way, or without having to want it to be a secret and something that is of your own, like you are on your own. So we're trying to break the glass, and have people be out there and be hopeful about their health, no matter what their age. So another thing that we are trying to address from our health advocates outward to the community is addressing the question of age, because most people think that this sickness thing starts all of a sudden when you're older, and which is not the case. So what we try to advocate for is to take a little bit more care of the health side of things at a much younger stage. So we are hoping to see more young people coming in, so that we address these things. We have this conversation from this stage on.
My name is Donzo Zundula. I'm a health promoter at Wits Health Hubb. We promote health. That's what we basically do mostly. We go around house to house, telling people about, mostly it's high blood pressure. So that's what we do, telling people how they can control it and more. And like everyone else, I applied looking for a job, hungry to learn more. So I got lucky. When you get to a house and you see a granny looking for help, and you become that hope. So that for me is the best moment. My hopes and dreams would be to see a more healthier country, more young people to be healthy. It starts with us. If we become healthy now, and then obviously we'll become healthy grannies, so our kids will be healthy as well. So we would have a healthy world. So a healthy nation.
My name is Gidiboni Shezi. I'm a health advocate at Wits Health Hubb. I have been an advocate for 3 months now. I love how we create awareness and help people to understand more deadly diseases like your diabetic, your high blood pressure, your cardio, everything that involves anything that gives out a strong feeling of not being well in terms of health. So I think us being a health advocate, going to houses, creating awareness, helping people understand and how to act and how to behave and how to live a healthy lifestyle makes who we are as health advocates to be productive. The most difficult part I've encountered personally, it's whereby we find a household with someone who is at a risk of getting high blood and is at a risk of getting a stroke or heart attack, and then that person refuses medical help. So I think that's a bit of a challenge for me personally, for someone who doesn't want to progress, to get better. The one that I have in my memory is, it's not me who helped, but it's one of our advocates, which was Gugu. So she went to a household whereby she found an uncle and an aunt living together, their siblings. So the uncle had stroke, so due to high blood, so he had stroke, and then he could not, he was paralyzed one side. So he could not find any help as in measures of physiotherapy, medication, and wheelchair because he was critical. But with the help of our assistants, with the help of us health advocates creating awareness and being there and going to the houses and finding out more about the situations of our fellow citizens of South Africa, she could help, and we managed to get him a wheelchair, we managed to get him help, we managed to get him medical advice and medical attention. So that stood out for me, and it made me realize that we are making a difference actually. My hopes, after this program, obviously we're going to get certificates which will be because of how hard we worked. And after that certificate, because I did not do life science at school, I'm going to do life science because now I have sudden interest in health. So I'm going to do life science, going to nursing, and then hopefully being a doctor and a specialist.